why do we do hand hygiene? We do hand hygiene because thousands of people die every day around the world from infections acquired while receiving healthcare. Our hands are the main pathway of germ transmission during healthcare. So, hand hygiene is therefore the most important measure to avoid the transmission of harmful germs and prevent healthcare-related infections. So, how do we do hand hygiene? We clean our hands by rubbing them with alcohol-based formula as prepared means for the routine hygienic hand antisepsis if hands are not visibly soiled. So, it is faster, more effective, and better tolerated by our hands than washing with soap and water. Wash your hands with soap and water when hands are visibly dirty or visibly soiled with blood or other body fluids or after using the toilet. If the exposure to potential spore-forming pathogen is strongly suspected or proven, including outbreaks of wash our hands with soap and water when hands are visibly dirty or visibly soiled with blood or other body fluids or after using the toilet. If exposure to a potential spore-forming pathogen is strongly suspected or proven, including outbreaks of Clostridium difficile, hand washing with soap and water is preferred means than hand rubbing. So who do hand hygiene? Any healthcare worker, caregiver, or person involved in direct or indirect patient care needs to be concerned about hand hygiene and should be able to perform it correctly and at the right time. So, the question is, when do we do the hand hygiene? There are 5 moments that we do the hand hygiene. First, we do hand hygiene before touching a patient. Second, before clean or aseptic procedure. Third is after body fluid exposure is. Fourth, after touching a patient. And fifth is after touching the patient's surroundings. So, why do we do hand hygiene before touching a patient? We do hand hygiene before touching the patient to protect the patient against colonization and in some cases against exogenous infection by harmful germs carried on our hands. Third and fourth, we do hand hygiene after body fluid exposure is and after touching the patient. It is to protect you from colonization with patient germs and to protect the healthcare environment from germ spread. Fifth, we do the hand hygiene after touching the patient's surroundings. It is to protect you from the colonization as well with the patient germs that may be present on surfaces or objects in patient surroundings and to protect the healthcare environment against germ spread. Now we're gonna do a procedure of hand washing. Now I'm gonna show you how to hand wash. So first, we're going to wet our hands with water and then apply soap to cover hand surfaces, then rub hands palm to palm, and then we're going to overlap the right palm over the left dorsum with an interface fingers with and vice versa. Next is we're going to do a palm to palm with fingers interface, and then back the fingers to opposing palms with the fingers interlock, and then rotational rubbing of left thumb clump in the right palm and vice versa. And then we're going to do the rotational rubbing backwards, forwards with the clasped fingers of right hand in left palm and vice versa. And now we're going to rinse our hands with water. And we need to dry our hands thoroughly with a single-use towel. And then we use the towel to turn off the faucet. Once our hands are dry, our hands are now safe. The duration of the entire procedure is around 40 to 60 seconds. We're gonna do a hand wash if our hands are visibly soiled. If it's not, we're gonna use our hand. We're gonna do hand rub. Now I'm gonna show you how to do hand rub. So we're going to do the rubbing of hands for hand hygiene. We do this when hands are visibly soiled. First, we're going to apply the pum of the product in a cup hand, covering all the surfaces. Then we're going to rub hands palm to palm, and then we're going to put our right palm over the left dorsum with interface fingers and vice versa. And then next, we're going to do the palm to palm with fingers interface, and then back of fingers opposing palms with fingers interlock. And then we're gonna do the rotational rubbing of left thumb gloves in the right palm and vice versa. After that, we're going to do the rotational rubbing of backwards and forwards clubs of fingers to the right hand in left palm and vice versa. Once our hands are dry, our hands are now safe. Hand care, we take care of our hands by regularly using protective hand cream or lotion at least daily. We also do not routinely wash our hands with soap and water immediately before or after using alcohol-based hand rub. We also do not use hot water while doing the procedure of hand washing. Also, after hand rubbing or hand washing, let our hands dry completely before putting on gloves. We also need to please remember, do not wear artificial fingernails or extenders when you are in direct contact with a patient. Also, keep a natural nails short. So don't let it grow too long. We still do hand hygiene even we use gloves because using the gloves does not replace the need for cleaning our hands, because hand hygiene must be performed when appropriate regardless of the indications of gloves use. So when we remove our gloves, we still need to perform hand hygiene when an indication occurs while wearing gloves. So we also need to discard gloves after each task and clean our hands because gloves that we use may carry germs. Wear gloves only when indicated according to standard and contact precautions. Otherwise, they become a major risk for germs transmission. The glove pyramid is to aid decision making on when to wear and not to wear gloves. So gloves must be worn according to standard and contact precaution. Take note that hand hygiene should be performed when appropriate regardless of indications for glove use. At the bottom of the pyramid, gloves not indicated except for contact precautions. No potential for exposure to blood or body fluids or contaminated environment. To direct patient exposure, we do taking blood pressure, temperature, and pulse, performing SC and IM injections, bathing and dressing the patient, transporting the patient, caring for eyes and ears. It is without secretions. Any vascular line manipulation in absence of blood leakage. For an indirect patient exposure, using the telephone, writing in the patient chart, giving oral medications, distributing or collecting patient dietary trays, removing and replacing linen for patient bed. We also placing non-invasive ventilation equipment and oxygen cannula, moving patient furniture. Middle of the pyramid, examination gloves indicated in clinical situations, potential for touching blood, body fluids, excretions, and items visibly soiled by body fluids. So, direct patient exposure, it is contact with blood, contact with mucous membranes, with non-intact skin, potential presence of highly infectious and dangerous organism, epidemic or emergency situations, IV insertions and removal, drawing blood, and discontinuation of venous line, also pelvic and vaginal examination, sanctioning non-closed systems of endotracheal tubes. In an indirect patient exposure, we use the examination gloves, which is indicated in clinical situations, emptying MNCs basins, handling and cleaning instruments, handling waste, cleaning up spills of body fluids. At the top of the pyramid, sterile gloves is indicated It is any surgical procedures, vaginal delivery, invasive radiological procedures, performing vascular access and procedures, central lines, preparing total parental nutrition, and chemotherapeutic agents.